We're seeing new indications that COVID is not over in this country. 24 states are reporting an increase in hospitalizations, and cases have jumped more than 50% nationwide over the last 2 weeks. Now, this comes as New York City raised its coronavirus alert level last week to medium risk, triggering a recommendation but not a requirement that people wear masks in public indoor settings. Dr. Celine Gounder is an epidemiologist who's editor-at-large for Public Health at Kaiser Health News and joins us now to help sort it all out for us. Good to see you again, Dr. Gounder. But I don't know anybody in this room that hasn't heard of someone who has it now, who may be in the hospital first, second time, or getting it again. What is happening? We heard that there's going to be a summer surge, but it's not summer yet. Why is this happening now?
Well, a couple factors. So one, you have this, or several of these ultra super infectious Omicron subvariants that are spreading across the country that got started here in New York City, but are now spreading elsewhere. Secondly, people are just tired. They're not masking, they're not social distancing, they're not doing the things they did earlier in the pandemic. And so, of course, the virus doesn't really care what we think. It's going to spread.
Are the people who are getting it, are they vaccinated? Are they boosted? What is their status in most cases?
There's some of both. The vaccines are excellent at keeping people out of the hospital.
But
they don't.
Hospitalizations are up.
Hospitalizations are up, and most of that is driven by people who are not vaccinated.
Well, speaking of surges, do you expect a fall and winter surge?
We do. And modeling out of the Biden administration would indicate we might have something like 100 million infections this fall, which is pretty similar, actually, to what we saw during the Omicron wave over the holidays.
Yeah. OK, so if people are eligible for a booster, should they wait till then to be better protected in the
wait till
fall
the
and
fall
the winter?
to get it?
I wouldn't try to game this out
To time
here.
it out?
You wouldn't.
I think it's been so hard to predict how this virus is going to spread, how it's going to mutate. I would say if you're over 50, you are eligible. If you're immunocompromised, you are eligible. Go ahead and get that fourth dose.
And what if you're under 50? You don't think you should get it?
Well, if you have an immunocompromising condition, if you have some other underlying medical illness where your physician thinks you're high risk, follow your physician's advice.
It feels like, regardless of the hospitalization rates or the case counts, that the country is moving toward a situation where fewer people are really afraid of the risk, right? So there's a lot more casual. Like, people get it. They're like, yeah, I got it. I'm just watching
feel great.
Netflix.
I'm
I
good.
feel great. I'm fine.
No, Tony, I now look at my calendar and say, if I'm going to get it, I hope I get it next week and not this week.
Yeah.
I mean, that's how crazy it is.
So, I mean, that's thanks to the science, to vaccines,
Right.
and to treatments if you get it. And it makes me wonder, as people get less fearful of COVID, is that what living with COVID looks like? Are we entering that period?
I think what we're seeing is similar to what we've seen with other infectious diseases. Take HIV, for example, where some people are pretty well protected because of their behaviors, because of their access to care. Other people get left behind. And I think what you're going to see is concentration of risk among certain populations who are going to be left behind. And that's what it will mean to live with COVID.
How do you write policies as a government, locally or nationally, when you have those two distinct groups?
Well, we could decide that we're not going to leave folks behind. That would mean doing things like expanding health insurance, so everybody has health insurance. 1 in 10 people in this country don't have health insurance. 1 in 4 adults don't have access to, don't have a primary care doctor. So we could change things like that so that some aren't left behind.
And where do you stand on testing? I've heard people say, I took the home test, it was negative. Right. Then I take a PCR test and it was positive. What is right here?
So the home tests lag about, say, 2 days from what a PCR test would show. So you might be PCR positive today, and it might take another 2 days before you show up rapid test at home positive. I think the key is to have options that you can exercise at home that are easy, cheap to do, in addition to going into a facility and getting tested with a PCR.
All right, Dr. Celine Gounder, good information as always. Thank you very much.